Hello class, I'm going to be talking about why the U.S. needs universal health care. Has it ever crossed your mind how many people have to suffer from a disease, injury, or illness but cannot afford to take care of it? According to a study done by researchers from Harvard Medical School, they have found that 45,000 Americans die every year as a direct result of not having any health insurance coverage. Also, in 2018, 27.8 million Americans went without health insurance for an entire year. According to World Health Organization, universal health coverage is defined as, quote, all people have access to the health services they need, when and where they need them, without any financial hardship. For decades, the United States healthcare system has been a problem. Our healthcare system needs some change. In today's world, everyone needs to have some kind of health insurance to seek medical help that they need. In some cases, it is nearly impossible for people to get that because the prices for it are skyrocketing. So to insurance companies, healthcare is not a human right, it is something they can make a profit off of. I view it as in comparison to a car or a house payment where you never really own insurance. In this life, there are rights to which we are entitled to. Among all the basic human rights we are entitled to, healthcare may just be the most crucial. The United States has made a system that is designed to not support and deny the right to health care. It is the only industrialized country without universal health care. We simply cannot enjoy the right to health care like other countries such as France or Germany. With universal health care, people all around the country do not have to suffer from injury, disease, or illness simply because they are poor or at the cost of having any financial hardships. According to ISPOR.org, in the article U.S. Healthcare System Overview, the United States' current healthcare system does not have universal healthcare, but it's more defined as a mixed system. It is also supported by one of the most complex healthcare systems in the world. There's publicly financed government, Medicare and Medicaid, that coexists with privately financed market coverage. And as of 2019, around 50% of citizens received private insurance coverage through their employer. 6% received private insurance through Health Insurance Marketplace, and 20% of citizens relied on Medicaid, 14% on Medicare, and the other 1% on any other public forms of insurance such as Veterans Health Administration and Military Health Service. That leaves 9% of Americans uninsured. The uninsured are less likely to seek and receive preventive care that often leads to them being diagnosed with diseases that are in more advanced stages, which result in them having a higher risk of dying, rather than individuals with health insurance. According to the World Health Reports, the U.S. spends the most on healthcare insurance, and it is ranked 37th in the world for healthcare quality. In the United States, there are hundreds of payers called insurance, and with universal healthcare, we can put an end to insurance companies so that they are all just as a single payer. Instead of paying the high-priced insurance that are currently put in place, the money can get pulled together into one public fund, which would cost less or even the same as we pay now. Our system is wasteful and unjust, and it seems that priorities have been forgotten, and making a profit off of this nation's citizens has been deemed more important than their health. We must consider other options other than Medicare for all, such as an American version of Germany's system, in which health insurance is mandatory and healthcare is provided by statute to people who cannot afford it, but people may buy private health insurance if they wish. The United States has a lower life expectancy, higher infant mortality, and a higher rate of mortality amenable to healthcare. That statistic basically means people are dying because they did not see a doctor in time. Rather than culturally and economically comparable nations such as Canada and the UK. Life expectancy in the United States varies sharply from state to state. We also must face the fact that our current system of providing healthcare is too expensive, inadequate, and not providing the care that we all need and deserve. As an American surgeon, Atul Gawande said, "This will take moral clarity, ingenuity, and willingness to try to make a change." If there was ever a better time to change the healthcare system, 2020 was the year to do it. 2 years have passed into the pandemic, and it has done nothing but left more than 1 million Americans dead, along with exposing the shortcomings of our nation's healthcare system. According to ProQuest.com in the article "It's Long Past Time to Reform the United States Healthcare" by Corey Edward T., In June of 2020, the National Academy of Science published a study that found that a single-payer healthcare system, quote, would have saved 212,000 people alone in 2020, and more than 338,000 over the course of the pandemic. That same study also found that $105.6 billion of medical expenses that were associated with COVID-19 hospitalizations, and that could have been averted by a single-payer universal healthcare system over the course of the pandemic as well. The healthcare system, plus the lives that were lost to inadequate health insurance, makes the need for reform. These two are quotes from Allison Galvani, the director of Center for Infectious Disease at the Yale School of Public Health, said, "Healthcare reform is long overdue in the United States, and Americans are needlessly losing lives and money." On ProQuest.com, in the article "What Happened to Medicare for All" by Ben Burgess, states that ensuring the 31 million people who do not have health insurance at all, while providing public insurance to far larger numbers who have to deal frequently with inadequate coverage from profit-driven private insurance companies, is urgent. So is freeing people who have good health insurance that is provided by their employer or their partner's employer, who end up being trapped in a bad job or even a bad marriage as a result. Okay. Some pros to having universal healthcare coverage in the United States include providing the same level of medical care for every legal citizen. It's lower cost for both citizens and healthcare providers. The government regulates healthcare costs. The U.S. having a longer life expectancy, along with being ranked higher for healthcare quality, and having an overall healthier population. Other countries with universal healthcare have been proven successful. Being able to have the right to healthcare will require all of us to act together as a society and take responsibility to ensure we can all exercise this right, such as calling your elected officials to discuss your thoughts on healthcare reform. We also need to stop comparing insurance and healthcare and demand universal healthcare. Although achieving universal healthcare coverage is the broadest step to take in protecting our economy, it will require everyone to engage in a debate on values, our commitment to a healthy and productive life for everyone, and addressing different strategies for achieving improved coverage and better performance for our nation's healthcare system. Serious change will require a broad census and a significant financial investment by federal and state government, employers, households, and other stakeholders. This is the responsibility of what is needed to achieve the goals of a change in a way that is effective. I know it's easier said than done, but as citizens, we must bring the system upon ourselves and for our future generation. And then I have a short clip of what healthcare
No,
looks
this
like.
is horrible.
What is it?
Oh, no, this is horrible.
What is it, Doctor?
This man has no insurance.
He'll never be able to afford this room.
You're right, nurse. Extract the patient to the hallway. Stat!